Navicular syndrome is a debilitating condition affecting the equine foot. It causes significant pain and lameness, often impacting a horse's performance and quality of life. The syndrome involves the navicular bone and surrounding structures within the hoof capsule. These structures include the navicular bursa, deep digital flexor tendon, and supporting ligaments. The condition is characterized by degeneration and inflammation, leading to chronic pain. Navicular syndrome is most commonly diagnosed in horses between 7 and 14 years old. However, it can occur at any age. Certain breeds, particularly those with upright conformation or small feet, are predisposed to navicular syndrome. Quarter horses, thoroughbreds, and warm bloods are some breeds where navicular syndrome is frequently observed. The syndrome often presents as bilateral lameness, meaning both front feet are affected, although one foot may be worse than the other. Conformation plays a crucial role in the development of navicular syndrome. Horses with certain conformational defects are more susceptible to experiencing abnormal stresses and strains on the navicular bone and surrounding tissues. These abnormalities in hoof and limb structure can predispose a horse to navicular changes. One of the most common conformational defects associated with navicular syndrome is an upright hoof. An upright hoof has a steeper angle than ideal, resulting in increased stress on the back of the foot, particularly the navicular bone and deep digital flexor tendon. Long toes and low heels, often seen with an upright hoof, further exacerbate the problem. Conversely, a horse with a long toe, low heel conformation will also be predisposed to navicular syndrome. The altered biomechanics of a horse with conformational defects contribute to the development of navicular syndrome. For instance, an upright hoof causes a shortened stride length and a harder impact on the ground. This impact sends a concussive force up the limb that is amplified at the navicular bone. The increased stress and concussion on the navicular bone and surrounding structures lead to inflammation and pain. Over time, these repetitive forces can cause significant damage. The constant pressure and strain on the navicular bone can lead to bone remodeling, cyst formation, and even fractures. The deep digital flexor tendon, responsible for flexing the foot, can also suffer from inflammation, adhesions, and degeneration. Section 4. Farriery. Approaches to managing navicular syndrome. Farriery plays a vital role in managing the symptoms of navicular syndrome. The primary goal of Farriery treatment is to reduce the strain on the deep digital flexor tendon and navicular bone. This is achieved by altering the hoof's conformation and mechanics through corrective shoeing and trimming. One of the most common Farriery techniques is the application of therapeutic shoes. These shoes are designed to provide support and redistribute weight bearing, alleviating pressure on the affected areas. For example, a shoe with a rolled toe, elevated heels, or a wedge insert can significantly improve comfort and soundness in horses with navicular syndrome. Regular trimming and shoeing are essential to maintain proper hoof balance and prevent the recurrence of pain. Section 5. Veterinary treatments for navicular syndrome. Veterinary treatment for navicular syndrome often involves a multimodal approach, addressing both the pain and inflammation associated with the condition and the underlying causes. Medications are frequently used to manage pain and inflammation. Non-steroidal anti-inflammatory drugs, such as phenylbutazone, also known as bute, or flunixin meglumine, commonly referred to as banamine, are commonly prescribed to reduce pain and inflammation. In some cases, corticosteroids may be injected into the navicular bursa or surrounding structures to provide more targeted pain relief. Other treatment options include bisphosphonates, which are drugs that alter bone metabolism and can help to alleviate pain associated with bone remodeling. Additionally, therapies like shockwave therapy, which uses high-energy sound waves to stimulate healing, and platelet-rich plasma therapy, which utilizes the body's own healing factors to promote tissue repair, may be recommended.